Here at KMTV3 News Now, we understand how an Alzheimer's diagnosis impacts so many of you. That's why you'll see interviews in the coming months about the disease, treatment, legislation, and more to help people and caregivers. UNMC and the Alzheimer's Association recently collaborated on a newly awarded grant for $3.7 million. I'm joined now by Clayton Freeman with the Alzheimer's Association and Dr. Jane Potter from UNMC. Thank you so much, both of you, for coming in.
Our pleasure, Jennifer.
Thank you very much.
Tell us a little bit about this grant. What will the money be used for?
So the title of the grant sort of tells it. This is the Geriatric Workforce Enhancement Program, and it's one of 48 federal grants distributed nationally. And the purpose of the grant is to implement geriatric practices for common health problems of older people within primary care. So we develop partnerships with primary care clinics, and through them do some teaching and also implement tools that they can use, for example, to evaluate people with Alzheimer's disease, but also for important problems like mobility issues and falls within older people, the problem of multiple medications and medication interactions. So it's really kind of a multi-pronged project.
Yeah, why is something like this important in terms of you're specialized in this field, but not every primary care physician is? And
that is correct.
Most people, if they're going to go to a doctor, they're just going to go to the doctor they've gone to for years, right?
And which is a wonderful idea because those are very long-standing relationships, and it's important that they be maintained. And a lot of geriatrics wasn't taught when a lot of people were in training. So this is an opportunity to do really some changes in practice, make it fit with the clinic flow within those practices so that they deliver state-of-the-art geriatric care within certain important areas.
With the Alzheimer's Association, why are these types of partnerships so critical for you?
Well, it's great because UNMC is opening the door for us in many ways to get into these clinics, to partner up with these organizations that are partnering with the grant, to provide education to these families, to caregivers, persons living with the disease. So education is knowledge is power. So we want to give them the information they need to understand the disease and to care better for their loved one. In addition to that, we're offering support groups, especially early stage support groups. So when a person is newly diagnosed, that person and their care partner can come together and receive the kind of support they need through a really kind of unique support group that we're developing. And it also provides us access to physicians. And as Dr. Potter said, we want to be able to go in and help physicians refer to us. So we can go in and say, as you diagnose someone, we want to be that next phone call. We want to be the person that you can get that family to, that we can give them the resources at our fingertips. So we're really proud of this and able to work with UNMC. And one of the groups, some minority groups we're going to be working with, who are at a higher risk for this disease. So that is also very important to us.
Kind of a basic question, but why should we as a society care so much about this aging population?
Well, they're the most frequent consumers and the most expensive consumers of health care. A lot of the common problems, if they're recognized and addressed early, actually can both improve the quality of life for the older people themselves, as well as help control healthcare costs.
So it's important that way. Of course, there are people we care about as well, and people we will one day become. So very important. Thank you so much. We appreciate you coming in.
Yes, absolutely.
Thank you.
Thank you.